Adult respiratory distress syndrome is a very common entity, and we see a lot of it in hospital patients, in hospital medicine. And let's do a case and talk about the scenario. A 32-year-old man is admitted to the ICU with gram-negative sepsis. He started on double gram-negative antibiotic coverage and remains stable. The blood cultures grow Pseudomonas, sensitive to the antibiotic, so you're treating the patient correctly. Initially, the patient seemed to improve, but during the second day, he developed severe dyspnea and hypoxemia. Diffuse crackles are noted on the exam, and the chest x-ray shows diffuse alveolar density. The admission x-ray was unremarkable, and I could tell you after this, the patient within 24-48 hours got worse and worse and died. So initially, got admitted for gram-negative sepsis for some reason or another. This guy was actually an injectable drug user, right? So, and then got better a little bit, a couple of days, within the course, and then all of a sudden got worse and developed, the pulmonary infiltrates, the densities, and so forth. So this is the typical adult respiratory distress syndrome that we see. And what is this all about? So ARDS is a very common disease. We see it a lot in the intensive care units, and it has to do with an increase in alveolar and capillary permeability. For some reason or other, something that the disease does, it triggers some kind of inflammatory process, people think, and it makes the alveolar and the capillary membrane leaky. That's why sometimes this syndrome was called capillary leak syndrome. So all of a sudden, maybe the gram-negative sepsis, it doesn't only occur with gram-negative sepsis, did something to the immune system in the patient and triggered this inflammatory response where all of a sudden the alveolar capillary permeability increased. What happens after that? Well, the lung fills with fluid. This is really non-cardiogenic pulmonary edema. The lung becomes stiff and non-compliant, and then the patient develops severe hypoxemia and hypercapnia, and then everybody crosses their fingers and hope that everything gets better on its own, because really, we really have no treatment